NCSBN-NCLEX RN 800 Practice Questions and Answers Newest Real Exam Prep. Question 1. The nurse will be alert to the most potentially life-threatening side effect associated with the administration of a monoamine oxidase inhibitor. This is which of the following? Option A. Oculogyric crisis. Option B. Hypertensive crisis. Option C. Orthostatic hypotension. Option D. Tardive dyskinesia. The correct answer is option B. Hypertensive crisis. The absolute, most terrifying, and instantly lethal complication of monoamine oxidase inhibitor therapy is a catastrophic hypertensive crisis, characterized by a violently exploding blood pressure, agonizing occipital headache, stiff neck, and impending stroke, triggered entirely by the accidental ingestion of tyramine-rich foods. Question 2. A 38-year-old client self-administers haloperidol 5 mg twice a day and benztropine 1 mg once a day. She tells the nurse she cannot stay still at night, tosses and turns, and cannot fall asleep. The nurse suspects that she may be experiencing which of the following? Option A. Akathisia. Option B. Akinesia. Option C. Dystonia. Option D. Opisthotonos. The correct answer is option A. Akathisia. The client's agonizing, inescapable, and relentless inner drive to constantly move, resulting in her absolute inability to sit still or sleep, is the exact, textbook clinical presentation of severe akathisia, a highly distressing motor restlessness caused directly by high-potency antipsychotics like haloperidol. Question 3. A chronic paranoid schizophrenic has been taking haloperidol in the morning and evening, and benztropine right before bedtime. The client complains of severe motor restlessness at night. The nurse might suggest to the client that she try which of the following? Option A. Doubling the daily dose of benztropine. Option B. Decreasing the haloperidol dosage for a few days. Option C. Taking the benztropine in the morning. Option D. Taking her medication with food or milk. The correct answer is option C. Taking the benztropine in the morning. Because the client is suffering from brutal, sleep-destroying motor restlessness at night, moving the daily dose of the potent anticholinergic benztropine to the morning is a brilliant, independent nursing strategy to maximize its symptom-blocking power during her waking hours when the akathisia is most disruptive. Question 4. A 27-year-old male client is admitted to the acute care mental health unit for observation. He has recently lost his job, and his wife wants a divorce. He is placed on suicide precautions. In assessing suicide potential, the nurse should pay close attention to the client's which of the following? Option A. Level of insight. Option B. Thought processes. Option C. Mood and affect. Option D. Abstracting abilities. The correct answer is option C. Mood and affect. When rigorously assessing a high-risk client for imminent suicide, the absolute, most terrifying clinical indicator is a sudden, dramatic improvement in their mood and affect, which often horrifyingly signals that they have finally, decisively resolved their agonizing ambivalence by firmly committing to a lethal suicide plan. Question 5. The nurse knows that children are more susceptible to respiratory tract infections owing to physiological differences. These childhood differences, when compared to an adult, include which of the following? Option A. Fewer alveoli, slower respiratory rate. Option B. Diaphragmatic breathing, larger volume of air. Option C. Larger number of alveoli, diaphragmatic breathing. Option D. Rounded shape of chest, smaller volume of air. The correct answer is option D. Rounded shape of chest, smaller volume of air. A child's respiratory mechanics are highly vulnerable because their chest is structurally rounded and barrel-shaped, which severely restricts their lung expansion, resulting in a dangerously smaller volume of air exchange and a massive, rapid susceptibility to overwhelming respiratory infections. Question 6. A 2-year-old toddler is hospitalized with epiglottitis. In assessing the toddler, the nurse would definitively expect to find which of the following? Option A. A productive cough. Option B. Expiratory stridor. Option C. A drooling. Option D. A crackles in the lower lobes. The correct answer is option C. Drooling. Epiglottitis is a terrifying, fulminating bacterial infection that causes massive, rapid swelling of the epiglottis. The intense agony of this swelling completely obliterates the child's ability to swallow, making continuous, profuse drooling the absolute, classic, and pathognomonic hallmark sign of this lethal airway emergency. Question 7. Which of the following nursing care goals has the highest priority for a child with epiglottitis? Option A. Sleep or lie quietly 10 hours per day. Option B. Consume foods from all 4 food groups. Option C. Be febrile throughout her hospital stay. Option D. Participate in play activities 4 hours per day. The correct answer is option A. Sleep or lie quietly 10 hours per day. For a child teetering on the absolute brink of total airway obstruction from epiglottitis, any stress, crying, or exertion exponentially spikes their oxygen demand. The absolute, highest, life-saving priority is keeping the child utterly calm and quietly resting to aggressively minimize their work of breathing. Question 8. Which of the following nursing orders has the absolute highest priority for a child with epiglottitis? Option A. Vital signs every shift. Option B. A tracheostomy set at bedside. Option C. Intake and output. Option D. The specific gravity every shift. The correct answer is option B. Tracheostomy set at bedside. Epiglottitis is a ticking time bomb that can cause complete, catastrophic, and instantly lethal airway occlusion at any second. It is an absolute, non-negotiable, ironclad medical mandate to have a fully stocked, emergency tracheostomy tray and intubation equipment immediately open and ready at the bedside at all times. Question 9. Often children are monitored with a pulse oximeter. The pulse oximeter specifically measures which of the following? Option A. Oxygen content of the blood. Option B. Oxygen saturation of arterial blood. Option C. Partial pressure of oxygen. Option D. The affinity of hemoglobin for oxygen. The correct answer is option B. Oxygen saturation of arterial blood. A pulse oximeter is a brilliant, non-invasive optical device that continuously shines light through the tissue to precisely and exclusively measure the exact percentage of oxygen saturation of hemoglobin exclusively in the pulsating, arterial blood. Question 10. A 4-year-old boy is brought to the emergency room with bruises on his head, face, arms, and legs. His mother states that he fell down some steps. The nurse strongly suspects that he may have been physically abused. In accordance with the law, the nurse must do which of the following? Option A. Tell the physician her concerns. Option B. Report her suspicions to the authorities. Option C. Talk to the child's father. Option D. Confront the child's mother. The correct answer is option B. Report her suspicions to the authorities. Under federal and state law, any healthcare professional who even slightly suspects child abuse is a strict, legally mandated reporter. The nurse absolutely must, without hesitation or requiring proof, immediately report her suspicions directly to the designated child protective authorities. Question 11. The mother of a preschooler reports to the nurse that he frequently tells lies. The admission assessment of the child indicates possible child abuse. The nurse knows that his behavior means which of the following? Option A. Behavior is not normal, and a child psychiatrist should be consulted. Option B. Mother is lying to protect herself. Option C. Lying is normal behavior for a preschool child who is learning to separate fantasy from reality. Option D. Behavior indicates a developmental delay, because preschoolers should be able to tell right from wrong. The correct answer is option C. Lying is normal behavior for a preschool child who is learning to separate fantasy from reality. The nurse expertly recognizes that what the mother perceives as lying is actually highly imaginative storytelling. This is an absolutely normal, universal, and expected developmental phase for a preschooler who is actively trying to master the complex cognitive boundary between rich fantasy and stark reality. Question 12. A family by court order undergoes treatment by a family therapist for child abuse. The nurse, who is the child's case manager, knows that treatment has been effective when which of the following occurs? Option A. The child is removed from the home and placed in foster care. Option B. The child's parents identify the ways in which he is different from the rest of the family. Option C. The child's father is arrested for child abuse. Option D. The child's parents can identify appropriate behaviors for children in his age group. The correct answer is option D. The child's parents can identify appropriate behaviors for children in his age group. Child abuse often horrifically stems from parents harboring wildly unrealistic, impossible expectations of a child's abilities. The absolute truest metric of therapeutic success is when the abusive parents finally learn and can accurately identify the normal, age-appropriate developmental behaviors expected of their child. Question 13. Nursing assessment of early evidence of septic shock in children at risk includes which of the following? Option A, fever, tachycardia, and tachypnea. Option B, respiratory distress, cold skin, and pale extremities. Option C, elevated blood pressure, hyperventilation, and thready pulses. Option D, normal pulses, hypotension, and oliguria. The correct answer is option A, fever, tachycardia, and tachypnea. In the terrifying, hyperdynamic early warm phase of pediatric septic shock, the body mounts a massive, explosive hypermetabolic response. The absolute classic, early warning signs are a raging fever, a violently pounding tachycardia, and rapid, relentless tachypnea. Question 14. A 3-year-old child is in the burn unit following a home accident. The absolute first sign of sepsis in burned children is which of the following? Option A, disorientation. Option B, low-grade fever. Option C, diarrhea. Option D, hypertension. The correct answer is option A, disorientation. In a severely burned child, the brain is exquisitely, terrifyingly sensitive to the very first microscopic traces of circulating bacterial toxins and hypoxia. Therefore, sudden, unexplained disorientation or a subtle change in the level of consciousness is the absolute, screaming first sign of impending, catastrophic sepsis. Question 15. One of the most reliable assessment tools for the adequacy of fluid resuscitation in burned children is which of the following? Option A, blood pressure. Option B, level of consciousness. Option C, skin turgor. Option D, fluid intake. The correct answer is option B, level of consciousness. While urine output is vital, a child's level of consciousness is an incredibly sensitive, real-time, and highly reliable clinical barometer. A clear, alert sensorium definitively proves that the massive fluid resuscitation is successfully, adequately perfusing the delicate, oxygen-hungry tissues of the brain. Question 16. A child with celiac disease is being discharged. The mother demonstrates knowledge of nutritional needs of her child when she is able to state the foods which are included in which of the following diets? Option A, lactose-restricted diet. Option B, a gluten-restricted diet. Option C, a phenylalanine-restricted diet. Option D, a fat-restricted diet. The correct answer is option B, gluten-restricted diet. Celiac disease is a severe, lifelong autoimmune destruction of the intestinal villi triggered entirely by the protein gluten. The mother absolutely must demonstrate a flawless understanding of a strict, 100% gluten-restricted diet, meaning zero wheat, barley, rye, or oats, to save her child's life. Question 17. An 80-year-old male client with a history of arteriosclerosis is experiencing severe pain in his left leg that started approximately 20 minutes ago. When performing the admission assessment, the nurse would expect to observe which of the following? Option A, both lower extremities warm to touch with 2+ pedal pulses. Option B, both lower extremities cyanotic when placed in a dependent position. Option C, decreased or absent pedal pulse in the left leg. Option D, the left leg warmer to touch than the right leg. The correct answer is option C, decreased or absent pedal pulse in the left leg. The sudden, agonizing pain in a client with severe arteriosclerosis is a massive red flag for an acute, catastrophic arterial occlusion. The nurse will immediately and definitively expect to find a severely decreased or completely absent pedal pulse in the dying, ischemic left leg. Question 18. A male client is scheduled to have angiography of his left leg. The nurse needs to include which of the following when preparing the client for this procedure? Option A, validate that he is not allergic to iodine or shellfish. Option B, instruct him to start active range of motion of his left leg immediately following the procedure. Option C, inform him that he will not be able to eat or drink anything for 4 hours after the procedure. Option D, inform him that vital signs will be taken every hour for 4 hours after the procedure. The correct answer is option A, validate that he is not allergic to iodine or shellfish. Angiography relies entirely on blasting the arterial system with a massive dose of radiopaque contrast dye, which is heavily laden with iodine. The absolute, life-saving priority is rigorously validating that the client does not have a lethal, anaphylactic allergy to iodine or shellfish. Question 19. A female client is started on warfarin 5 mg orally twice a day. To adequately evaluate the effectiveness of the warfarin therapy, the nurse must know that this medication accomplishes which of the following? Option A dissolves any clots already formed in the arteries. Option B prevents the conversion of prothrombin to thrombin. Option C interferes with the synthesis of vitamin K dependent clotting factors. Option D stimulates the manufacturing of platelets. The correct answer is option C. Interferes with the synthesis of vitamin K dependent clotting factors. The nurse must possess the exact, deep pharmacological knowledge that warfarin does not dissolve clots, but acts as a powerful, systemic anticoagulant strictly by ruthlessly interfering with the liver's synthesis of the four vital, vitamin K dependent clotting factors, thereby paralyzing the coagulation cascade. Question 20. A client is to be discharged from the hospital and is to continue taking warfarin. Which of the following should be included in her discharge teaching concerning the warfarin therapy? Option A. If you forget to take your morning dose, double the nighttime dose. Option B. You should take aspirin instead of acetaminophen for headaches. Option C. Carry a medications alert card with you at all times. Option D. You should use a straight edge razor when shaving your arms and legs. The correct answer is option C. Carry a medications alert card with you at all times. Because the client is taking a powerful, life-altering anticoagulant, they are at massive risk of catastrophic, uncontrollable hemorrhage if injured. They absolutely must carry a highly visible medical alert card at all times to instantly warn emergency personnel of their severely compromised clotting status. Question 21. A 40-year-old client has been admitted to the hospital with severe substernal chest pain radiating down his left arm. The nurse caring for the client establishes the priority nursing diagnosis of alteration in comfort, pain related to which of the following? Option A. Increased excretion of lactic acid due to myocardial hypoxia. Option B. Increased blood flow through the coronary arteries. Option C. Decreased stimulation of the sympathetic nervous system. Option D. Decreased secretion of catecholamines secondary to anxiety. The correct answer is option A. Increased excretion of lactic acid due to myocardial hypoxia. The crushing, agonizing pain of a myocardial infarction is directly caused by severe myocardial hypoxia. The starving, suffocating heart muscle is forced into anaerobic metabolism, spewing out massive, toxic amounts of lactic acid that violently irritate the neural receptors, producing the excruciating chest pain. Question 22. Morphine sulfate 4 mg intravenous push every 2 hours as needed for chest pain was ordered for a client. The nurse administering the morphine sulfate knows which of the following therapeutic actions is related to the morphine sulfate. Option A. Increased level of consciousness. Option B. Increased rate and depth of respirations. Option C. Increased peripheral vasodilation. Option D. Increased perception of pain. The correct answer is option C. Increased peripheral vasodilation. Morphine sulfate is not just a painkiller, it is a profound cardiovascular drug. It acts as a powerful, systemic vasodilator, triggering massive increased peripheral vasodilation, which critically slashes the venous return, drastically reducing the crippling preload and oxygen demand on the dying heart. Question 23. A client had a cardiac catheterization and thrombolytic therapy with streptokinase. The nurse should initiate which of the following interventions immediately after he returns to his room? Option A. Place him on nothing by mouth restriction for 4 hours. Option B. Monitor the catheterization site every 15 minutes. Option C. Place him in a high Fowler position. Option D. Ambulate him to the bathroom to void. The correct answer is option B. Monitor the catheterization site every 15 minutes. Because the client has just been blasted with streptokinase, a massively powerful, systemic clot-busting drug, his blood cannot clot. The absolute, paramount, life or death priority is to aggressively, obsessively monitor the femoral puncture site every 15 minutes for catastrophic, lethal hemorrhage. Question 24. The nurse notes scattered crackles in both lungs and 1+ pitting edema. The physician orders furosemide 80 mg intravenous push stat. Which of the following diagnostic studies is monitored to assess for a major complication of this therapy? Option A. Serum electrolytes. Option B. Arterial blood gases. Option C. Complete blood count. Option D. A 12-lead electrocardiogram. The correct answer is option A, serum electrolytes. Furosemide is an incredibly potent, fast-acting loop diuretic that violently flushes massive amounts of fluid, sodium, and critically, potassium, out of the kidneys. The nurse must obsessively monitor serum electrolytes to instantly catch the rapid, terrifying, and highly dangerous development of profound hypokalemia. Question 25. Prior to his discharge, a cardiac client is started on digoxin. Which of the following statements by the client would validate an understanding of his medication? Option A. I would notify my physician immediately if I experience nausea, vomiting, and double vision. Option B. I could stop taking this medication when I begin to feel better. Option C. I should only take the medication if my heart rate is greater than 100 beats per minute. Option D. I should always take this medication with an antacid. The correct answer is option A. I would notify my physician immediately if I experience nausea, vomiting, and double vision. Digoxin possesses a terrifyingly narrow, razor-thin therapeutic window. The client perfectly demonstrates vital, life-saving knowledge by correctly identifying the classic, ominous early warning signs of severe, potentially fatal digoxin toxicity, sudden nausea, violent vomiting, and bizarre visual disturbances like double vision or yellow halos. Question 26. When assessing a client, the nurse notes the typical skin rash seen with systemic lupus erythematosus. Which of the following descriptions correctly describes this rash? Option A. Small round or oval reddish-brown macules scattered over the entire body. Option B is scattered clusters of macules, papules, and vesicles over the body. Option C. Bright red appearance of the palmar surface of the hands. Option D. Reddened butterfly-shaped rash over the cheeks and nose. The correct answer is option D. Reddened butterfly-shaped rash over the cheeks and nose. The absolute, diagnostic, textbook hallmark of systemic lupus erythematosus is the striking, fiery red, perfectly symmetric macular rash that violently erupts straight across the bridge of the nose and spreads outward over both cheeks, creating an unmistakable, classic butterfly-shaped pattern. Question 27. The nurse notes multiple bruises on the arms and legs of a newly admitted client with lupus. The client states she gets them whenever she bumps into anything. The nurse would expect to note a decrease in which of the following laboratory tests? Option A. Number of platelets. Option B. White blood cell count. Option C. A hemoglobin level. Option D. The number of lymphocytes. The correct answer is option A. Number of platelets. Systemic lupus erythematosus unleashes a massive, vicious autoimmune assault on the body's own blood cells. The sudden, terrifying appearance of widespread, severe bruising from minimal trauma is a screaming, classic clinical indicator of profound, dangerous autoimmune thrombocytopenia, a drastic plunge in the number of blood clotting platelets. Question 28. A client is started on prednisone 2.5 mg orally twice a day. Which of the following instructions should be included in her discharge teaching specific to this medication? Option A. Increase your oral intake of fluids to at least 4,000 milliliters every day. Option B. Avoid contact with people who have contagious illnesses. Option C. Brush your teeth at least 4 times a day with a firm toothbrush. Option D. Immediately stop taking the prednisone if you feel depressed. The correct answer is option B. Avoid contact with people who have contagious illnesses. Prednisone is a massive, potent, and deeply systemic glucocorticoid that violently suppresses the body's entire immune system. The absolute most critical, life-saving instruction is to rigorously, obsessively avoid any contact with sick people, as the client is now terrifyingly vulnerable to catastrophic, lethal infections. Question 29. During the assessment, the nurse observes a client violently scratching his skin. He has been admitted to rule out Lennox cirrhosis of the liver. The nurse knows the intense pruritus is directly related to which of the following? Option A. A loss of phagocytic activity. Option B. A faulty processing of bilirubin. Option C. Enhanced detoxification of drugs. Option D. The formation of collateral circulation. The correct answer is option B. Faulty processing of bilirubin. As the scarred, failing liver completely loses its ability to conjugate and excrete bile, massive, toxic levels of highly irritating bile salts aggressively back up into the bloodstream and are deposited directly into the skin tissues, triggering excruciating, relentless, and maddening generalized pruritus. Question 30. A client with cirrhosis is receiving an intravenous infusion of albumin. The nurse evaluates the client for which of the following expected therapeutic effects. Option A, decreased heart rate and blood pressure. Option B, increased urinary output. Option C, adventitious breath sounds and dyspnea. Option D, chills, fever, and itching. The correct answer is option B, increased urinary output. Albumin is a massive, powerful hypertonic colloid. When infused, it exerts an enormous osmotic pull, violently dragging third-spaced edema fluid straight back into the vascular system. The kidneys rapidly filter this newly restored blood volume, resulting in the desired, highly therapeutic spike in massive urinary output. Question 31. A client is receiving an intravenous infusion of albumin. The nurse evaluates the client for which of the following expected therapeutic effects. Option A, decreased heart rate and blood pressure. Option B, increased urinary output. Option C, adventitious breath sounds and dyspnea. Option D, chills, fever, and itching. The correct answer is option B, increased urinary output. Albumin acts as an incredibly potent blood volume expander by exerting a massive osmotic pull on fluids trapped in the interstitial spaces, violently yanking them back into the circulatory system. This dramatic, sudden fluid shift floods the kidneys, directly causing a significant, highly therapeutic increase in urinary output. Question 32. A client with cirrhosis of the liver becomes comatose and is started on neomycin 300 mg every 6 hours via nasogastric tube. The rationale for this therapy is to do which of the following? Option A, prevent systemic infection. Option B, promote diuresis. Option C, decrease ammonia formation. Option D, acidify the small bowel. The correct answer is option C, decrease ammonia formation. Hepatic coma is caused by a massive, lethal buildup of neurotoxic ammonia. Neomycin is a heavy-hitting, non-absorbable antibiotic deployed specifically to ruthlessly eradicate the immense colonies of intestinal bacteria that are actively, maliciously breaking down protein and generating that deadly ammonia. Question 33. The following nursing diagnosis is written for a comatose client with cirrhosis of the liver and secondary splenomegaly, high risk for injury bleeding related to which of the following? Option A, increased absorption of vitamin K. Option B, thrombocytopenia due to hypersplenism. Option C, the diminished function of the Kupffer cells. Option D, increased synthesis of the clotting factors. The correct answer is option B, thrombocytopenia due to hypersplenism. In severe cirrhosis, massive portal hypertension causes the spleen to become terrifyingly engorged. This hypersplenism turns the spleen into a vicious, overactive trap that aggressively sequesters and ruthlessly destroys the body's circulating platelets, causing a profound, dangerous thrombocytopenia and a massive, life-threatening susceptibility to catastrophic hemorrhage. Question 34. A 52-year-old female client is admitted to the hospital in acute renal failure. Stat arterial blood gases are drawn yielding pH 7.30, partial pressure of carbon dioxide 51, bicarbonate 18, partial pressure of oxygen 84. The nurse would interpret these results as which of the following? Option A, compensated metabolic alkalosis. Option B, respiratory acidosis. Option C, partially compensated metabolic alkalosis. Option D, combined respiratory and metabolic acidosis. The correct answer is option D, combined respiratory and metabolic acidosis. This is an absolute, catastrophic acid-base disaster. The plunging pH of 7.30 proves severe acidosis. The skyrocketing carbon dioxide of 51 proves a massive respiratory acidosis, while the simultaneously crashing bicarbonate of 18 proves a severe metabolic acidosis, confirming a terrifying, lethal combined respiratory and metabolic acidosis. Question 35. Stat serum electrolytes ordered for a client in acute renal failure revealed a serum potassium level of 6.4. The physician orders 50 milliliters of dextrose and 10 units of regular insulin intravenous push. The nurse knows the rationale for this therapy is to do which of the following? Option A, remove the potassium from the body by renin exchange. Option B, protect the myocardium from the effects of hypokalemia. Option C, promote rapid protein catabolism. Option D, drive potassium from the serum back into the cells. The correct answer is option D, drive potassium from the serum back into the cells. A potassium level of 6.4 is a massive, screaming, and instantly lethal cardiac emergency. Blasting the client with a rapid intravenous push of insulin and dextrose creates a powerful metabolic engine that violently forces the deadly, circulating potassium straight back inside the cells, instantly rescuing the heart from fatal arrhythmias. Question 36. The nurse writes the following nursing diagnosis for a client in acute renal failure, impaired gas exchange related to which of the following? Option A, decreased red blood cell production. Option B, increased levels of vitamin D. Option C, increased red blood cell production. Option D, decreased production of renin. The correct answer is option A, decreased red blood cell production. The failing, dying kidneys completely cease the vital production of the hormone erythropoietin. Without it, the bone marrow utterly fails to produce new red blood cells, causing a profound, devastating anemia that critically slashes the blood's oxygen-carrying capacity, resulting in severe, systemic impaired gas exchange. Question 37. A 6-year-old child returned to the surgical floor after an appendectomy. He is restless and anxious. Assessment findings indicate that the child has atelectasis. Appropriate nursing actions would include which of the following? Option A, allowing the child to remain in the position of comfort, preferably semi or high Fowler position. Option B, administering analgesics as ordered. Option C, having the child turn, cough, and deep breathe every 1 to 2 hours. Option D, remaining with the child and keeping as calm and quiet as possible. The correct answer is option C, having the child turn, cough, and deep breathe every 1 to 2 hours. Atelectasis means the delicate alveoli in his lungs have terrifyingly collapsed. The absolute, non-negotiable, and aggressive nursing intervention to save his respiratory function is to ruthlessly force him to turn, cough, and take massive, deep breaths every single hour to violently pop those collapsed air sacs back open. Question 38. A client develops an intestinal obstruction postoperatively. A nasogastric tube is attached to low, intermittent suction with orders to irrigate with sterile saline every hour. The rationale for using sterile saline, as opposed to using sterile water, is which of the following? Option A, water will deplete electrolytes resulting in metabolic acidosis. Option B, a saline will reduce the risk of severe, colicky abdominal pain during irrigation. Option C, water is not isotonic and will increase restlessness and insomnia. Option D, a saline will increase peristalsis in the bowel. The correct answer is option A. Water will deplete electrolytes resulting in metabolic acidosis. Sterile water is a severely hypotonic solution. If used to continuously irrigate a nasogastric tube, it will aggressively, osmotically suck massive amounts of vital, life-sustaining electrolytes straight out of the gastric mucosa, violently flushing them away into the suction canister and triggering a catastrophic, lethal metabolic alkalosis or acidosis. Question 39. A 35-year-old client has returned to her room following surgery on her right femur. She last voided 5.5 hours ago when she was given her preoperative medication. In monitoring urinary function, the nurse would do which of the following? Option A, provide food and fluids at the client's request. Option B, maintain intravenous fluids, increasing the rate hourly until the client voids. Option C, report to the surgeon if the client is unable to void within 8 hours of surgery. Option D, hold morphine sulfate injections for pain until the client voids. The correct answer is option C. Report to the surgeon if the client is unable to void within 8 hours of surgery. Following the immense trauma of surgery and the paralyzing effects of anesthesia, the bladder can dangerously lose its tone. The absolute, strict clinical protocol is that if the client completely fails to void within a critical 8-hour window, the surgeon must be instantly notified for immediate, emergency catheterization orders to prevent massive bladder rupture. Question 40. A 47-year-old male client is admitted for colon surgery. Intravenous antibiotics are begun 2 hours prior to surgery. He has no known infection. The rationale for giving antibiotics prior to surgery is to do which of the following? Option A, provide cathartic action within the colon. Option B, reduce the risk of wound infection from anaerobic bacteria. Option C, or relieve the client's concern regarding possible infection. Option D, reduce the risk of intraoperative fever. The correct answer is option B. Reduce the risk of wound infection from anaerobic bacteria. The human colon is an absolute, seething cesspool packed with trillions of incredibly dangerous, lethal anaerobic bacteria. Blasting the client with massive, prophylactic intravenous antibiotics immediately before the surgeon slices the bowel open is the absolute, most critical strategy to ruthlessly prevent a catastrophic, fatal postoperative wound infection or sepsis. Question 41. A 19-month-old child is admitted to the hospital for surgical repair of patent ductus arteriosus. The child is being given digoxin. Prior to administering the medication, the nurse should do which of the following? Option A. Not give the digoxin if the pulse is less than 60. Option B. Not give the digoxin if the pulse is less than 100. Option C. Take the apical pulse for a full minute. Option D. Monitor for visual disturbances, a side effect of digoxin. The correct answer is option C. Take the apical pulse for a full minute. Digoxin is an incredibly potent, highly dangerous cardiac glycoside with a razor-thin margin of safety. The absolute, non-negotiable, ironclad nursing law before administering a single drop to a child is to meticulously, obsessively auscultate the apical pulse for one full, uninterrupted minute to detect any terrifying, subtle arrhythmias. Question 42. The family member of a child scheduled for heart surgery states they do not understand open heart or closed heart business. The nurse explains that patent ductus arteriosus repair is which of the following? Option A. Open heart surgery. The child will be placed on a heart-lung machine. Option B. Closed heart surgery. It does not require that the child be placed on the heart-lung machine. Option C. A pediatric version of the coronary artery bypass graft surgery. It is an open heart surgery. Option D. A pediatric version of percutaneous transluminal coronary angioplasty. It is a closed heart surgery. The correct answer is option B. Closed heart surgery. It does not require that the child be placed on the heart-lung machine. The nurse explicitly reassures the terrified family that patent ductus arteriosus repair is definitively a closed heart procedure. The surgeon operates exclusively on the great vessels entirely outside the heart itself, meaning the child absolutely does not need to endure the massive trauma of being placed on a heart-lung bypass machine. Question 43. A child is to receive atropine 0.15 mg as part of his preoperative medication. A vial containing atropine 0.4 mg per milliliter is on hand. How much atropine should be given? Option A is 0.06 milliliters. Option B is 0.38 milliliters. Option C, 2.7 milliliters. Option D, information given insufficient to determine the amount of atropine to be administered. The correct answer is option B, 0.38 milliliters. This requires absolute, flawless, life or death medication math. Using the standard formula, desired dose of 0.15 mg, divided by the available dose of 0.4 mg, and multiplied by the volume of 1 milliliter, perfectly yields exactly 0.375, which strictly rounds to 0.38 milliliters. Question 44. Following a gastric resection, a 70-year-old client is admitted to the post-anesthesia care unit. He was extubated prior to leaving the suite. On arrival, the nurse should do which of the following? Option A, check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. Option B, obtain pulse and blood pressure readings noting rate and quality of pulse. Option C, reassure the client that his surgery is over and that he is in the recovery room. Option D, review physician's orders, administering medications as ordered. The correct answer is option A. Check airway, feeling for amount of air exchange noting rate, depth, and quality of respirations. In the immediate, highly volatile moments upon hitting the recovery room doors, the absolute, supreme, unyielding ABC priority is the airway. The nurse must instantly, aggressively assess the airway, physically feeling for air exchange to guarantee the newly extubated client isn't silently, rapidly suffocating to death. Question 45. A 25-year-old client is admitted for a tonsillectomy. Her father died shortly after surgery after developing a high fever. Her surgeon is having her take dantrolene sodium prophylactically. Dantrolene sodium is ordered to reduce the risk or prevent which of the following? Option A, infection postoperatively. Option B, malignant hyperthermia. Option C, neuroleptic malignant syndrome. Option D, a fever postoperatively. The correct answer is option B, malignant hyperthermia. A family history of death from a high fever during surgery is a screaming, massive red flag for the terrifying, genetically linked nightmare of malignant hyperthermia. Dantrolene sodium is the absolute, one and only, highly specific life-saving antidote explicitly deployed prophylactically to ruthlessly block this catastrophic, explosive, and rapidly fatal hypermetabolic muscular crisis.